Good evening. I'd like to thank everyone for coming to tonight's Joint Development and Health and Human Services hearing. Councilmember Tyson and I will hear testimony on the city's 5-year consolidated submission to the United States Housing and Urban Development Department. I want to thank the following individuals for being here this evening and for being part of the consolidated submission process. I'd like to start off with Director Rakowski for the Department of Finance and Management, Zachary Crafton, Senior Research Associate, Community Research Partners, Nicole M. Brandon, Deputy Director, Department of Development, Audrey Regan, Director of Sexual Health Promotion, Columbus Public Health, Steve Allmiller, Assistant Director, Department of Recreation and Parks. And I'd like to offer the opportunity to Councilmember Tyson if you have any opening comments.
Thank you, Councilmember Mills, and I'm just very excited about this evening's hearing, not only because of what this process means in terms of its financial implications to the city, but also what it means to the great communities in which we live. The Consolidated Plan will outline how funding from the federal government will support the programs and services that our residents and neighborhoods depend on. So again, I'm looking forward to hearing from our presenters and learning more about the details of our Consolidated Plan.
Thank you, Councilmember Tyson. I want to make the public aware that we will be accepting speaker slips until 5:30 this evening. Speaker slips can be found right outside the opening doors of chambers. And again, please complete those slips and submit them before 5:30, and they should be turned into my legislative assistant, Devin Perros, who is sitting just behind me. Just to give a little bit of background about tonight's hearing, at Monday's council meeting, I tabled ordinance 2382-2014 to allow for this hearing and certainly for an additional period of public comment. This ordinance presents the 5-year consolidated submission for community planning and development programs. The consolidated submission consists of the consolidated plan, the citizen participation plan, and the action plan. The consolidated plan and related components consolidate into one single submission, and the planning and application aspects of the Community Development Block Grant, otherwise known as CDBG, most people say it so fast we all don't know what the acronym stands for. Home Investment Partnership, otherwise known as HOME, Emergency Solutions Grant, you'll hear referred to as ESG, and Housing Opportunities for Persons with AIDS, otherwise known as HOPWA. And again, we use acronyms sometimes, there's so much alphabet soup, but I trust and believe that the directors and those presenting this evening will speak in a language that allows our community to be better educated about CDBG and the entire consolidated plan and process. The plan represents a continued commitment to providing decent housing and suitable living environments and expanding economic opportunities. Tonight, we'll hear from Community Research Partners, who plays a very intricate role. They will speak about the process and how we arrived at our current consolidated plan and a process of which they have administered when it comes to citizen engagement. We will also hear from each of the city departments that administer the grants the city receives from HUD, again, HUD being Housing and Urban Development, via the consolidated plan. I'd like to turn the hearing over with, starting off with Director Rakowski and giving us an introduction to this planning process. Thank you, Director Rakowski. The floor is yours.
Good evening, and it's not often that I can say Chair Mills and Chair Tyson. It's nice to have co-chairs here tonight of the process. That was a very thorough and informative introduction. I'll try not to be too duplicative in some of the comments that I make, but I'll give a little introduction here, and as you said, we'll bring Zach Crafton up to talk a little bit about the process that CRP helped the city and the development department with, and then I'll explain at the end of all of my statements a little bit about our budget. It's a small piece of the overall entitlement, but I will explain that as well. I want to thank, I have Phil Carter here from my office. Phil heads up our grant management staff. Also Vicki Davidson, who does a lot of work on all of the budgeting for the departments and the way that we allocate, especially the entitlement dollars to the other departments, as well as the other directors that are involved and their staff and fiscal staff that are involved in all of this. A lot of work goes into what we end up presenting at the end of this process. As you mentioned, the City of Columbus is an entitlement jurisdiction that receives federal funds from HUD to support local community development and affordable housing activities. The federal block grant programs that provide these resources include, as you mentioned, the Community Development Block Grant, as you said, CDBG, the Home Investment Partnership Program that does go by the acronym HOME, so that's a little easier one to understand. The Emergency Solutions Grant, which we refer to as the ESG, and the Housing Opportunities for Persons with AIDS Grant, the HOPWA. And as a condition of receiving these funds, the City of Columbus is required by HUD to submit a 5-year consolidated plan that is updated every 5 years that outlines the city's housing and community development needs and priorities. We also, this year, will be submitting the first year annual action plan budget, and that action plan budget then will become the second, third, fourth, and fifth year as we move through the plan's years until we get to that point where we have to create a new 5-year consolidated plan. That'll identify how the city plans to allocate its HUD funding and the various grants to address those priority needs in the current year. And then, as you mentioned, a citizen participation plan. And that describes the city's policies and the procedures for public involvement in the whole consolidated plan and planning process. The consolidated plan serves as a document that guides the priorities and expenditure of the CDBG, the HOME, the ESG, and the HOPWA funds that are received by the city. And as you mentioned, for the development of the 2015 through 2019 consolidated plan, the city's Department of Development contracted with Community Research Partners. Community Research Partners, Mr. Zach Crafton is going to come up, and I'd ask him to come up at this point to present an overview of the proposed 2015 through 2019 consolidated plan.
Welcome, Mr. Crafton. If you would do me a huge favor and talk about CRP's experience and a couple other pieces when it comes to citizen engagement before you start talking and sharing your parts about the role here and just some other things that people may have heard from CRP, those who may not be familiar with your work. Thank you.
Sure. Community Research Partners, CRP, as you said, we're a local nonprofit research, evaluation, and data center here in Columbus. And we conduct a lot of different research projects for government, other nonprofit organizations, foundations. In the past, we put together the previous 2 consolidated plans for the City of Columbus, so the 2010 and then the 2005 before. And through that process, we also went through and a community participation process to engage residents and get feedback from them on their thoughts for the priority needs for the city. So we do have past experience working on consolidated plans, and then the other work that we do in evaluations, focus group interviews for some of our reports. We get feedback from citizens through those projects as well. So I want to start by thanking Councilmember Mills and Councilmember Tyson for inviting me to speak today. I'm here to give a brief overview of the consolidated plan process and to discuss the sections that make up the plan. But before I begin, I do want to briefly touch on the role that Community Research Partners played for this consolidated plan. And as I said, CRP is a nonprofit research and evaluation organization, and we were contracted by the City of Columbus to collect and analyze primary and secondary data for the consolidated plan. So really our primary role was to analyze data, report findings, and also to organize this information into the consolidated plan itself. So the 2015 5-year consolidated plan, it's divided into 4 main sections. The plan, and let me see if I can get this to work here. The plan begins with the community input and participation section, which is followed by the needs assessment, the housing market analysis, and the strategic plan section. So these 4 sections really served as our framework for creating a community-wide discussion that was focused on identifying the city's priority housing needs, and also the community development needs of the city. And the process we used to identify these needs was reliant on the input we received from the community and also the finding from our data analyses. So the end goal really of the consolidated planning process was to identify the city's priority housing and community development needs, and then to focus on developing a series of strategic plan goals that would address these needs over the 5-year consolidated planning period. So the first section of the consolidated plan focuses on reaching out to the community. And community participation really did play a very important role in the process. In fact, the first step we took in developing the consolidated plan was to ask residents and community stakeholders to tell us what they considered to be the city's most pressing needs. We collected community feedback in 2 ways. The first way was through an online resident survey, and the second way was through a series of focus group interviews with representatives from community stakeholder organizations. The online survey asked residents to identify priority needs in 5 broad topic areas that were related to the consolidated plan, and a link to the survey was posted on the city's website and also on CRP's website for a total of 8 weeks. So we wanted to ensure that the survey reached as many residents as possible. So CRP contacted 120 local organizations and asked them if they would help share the survey with their clients, stakeholders, and members. And these organizations included civic associations, government departments, minority diversity service agencies, faith-based groups, community development organizations, and many other local stakeholders. And as a result of our outreach effort, we were able to collect input from a more diverse group than we would have had we just put the link to the survey on the city's website without any advertisement. So they really helped us get a more diverse feedback from the community. So through this outreach effort, we collected input from a total of 833 residents, and then we analyzed the survey results and were able to determine the top housing and community development needs that were identified by the community through the survey. And the table here on this slide summarizes the top priority needs that were identified by residents for each of the 5 topic areas we asked them about. And as you can see in the table, in terms of affordable housing, residents identified that there's a great need for additional assistance to people to maintain safe and affordable housing, and that funding should be prioritized to programs that focus on things like foreclosure prevention and emergency home repairs. With regard to neighborhood revitalization, residents said that fixing up or eliminating vacant properties is the most important issue in the city. In terms of community and economic development, residents said that funding should be prioritized for programs that focus on creating jobs and attracting more businesses downtown. With human, social, and supportive services, residents said that there's a need for more youth and child care programs. And in terms of helping the homeless population, residents felt that there's a need for more programs that are focused on mental health and substance abuse treatment. So these are some of the key findings that came out of the resident survey. However, as I mentioned earlier, this wasn't the only way that we collected input from the community. We also gathered feedback through a series of focus group interviews with community stakeholders. The focus group interviews brought together local subject matter experts to discuss community needs that were related to their specific area of expertise, and we also asked them to identify how community needs have changed since the last consolidated plan. So more than 100 individuals representing 66 different government, nonprofit, and private entities were invited to participate in these focus group interviews, and a total of 56 people representing 39 different organizations attended. So you can see on this slide the primary topic areas of each of the 9 focus group interviews that we held. You can see that groups are organized around topics such as affordable housing, supportive services, community and economic development, and other areas that were related to the consolidated plan. And once the focus groups were completed, we analyzed the interviews and summarized the key findings. And one of the interesting findings that we came up with was that the priority needs that were discussed by stakeholders in the focus groups were closely aligned with the needs that I just explained just described from the resident survey. So there was a lot of overlap between the needs that were being talked about in the focus group by the community stakeholders and also what residents were saying were the biggest housing and community development needs in the city. So from this, it indicates that there is at least some general community consensus about some of the greatest housing and community development needs in the city. The next two sections of the consolidated plan are the needs assessment and housing market analysis sections. And I'm going to talk about both of these sections simultaneously because in both a large amount of secondary data are analyzed to determine local trends and needs. So the findings from the needs assessment and housing market analysis are really meant to complement the findings from the community participation section. And that's because they're based on reliable data, which means they can be used as evidence to support or refute any of the feedback that we heard from the community. So they're really there to give us evidence as to whether or not the priority needs that were talked about by the community, if we're seeing those same needs through data. In these sections, we analyze data from a wide range of sources, including the U.S. Census Bureau at the federal level, the Ohio Department of Health at the state level, the Community Shelter Board at the local level, and a lot of other different organizations. The following slides, so the one that I was just on and the next one, list the topic areas that were analyzed, and you can see when looking at the slides that all the topic areas that are pertinent to the consolidated plan we also conducted a data analysis for. So there's an assessment of housing needs, housing cost, public housing, homeless facilities, barriers to affordable housing, and what have you. Now, due to the large number of findings that resulted from these analyses, I'm not going to discuss the specific findings from the needs assessment and housing market analysis. However, I do want to emphasize that the data that was used and analyzed in these sections were used in the development of both the strategic plan goals and the 2015 action plan budget. So the final section of the consolidated plan is the strategic plan. And the strategic plan is really a culmination of all the work that was done in the previous sections. And what I mean by this is that all the key findings from the needs assessment, the housing market analysis, and the community participation sessions were used to develop a full list of priority needs that is found in the strategic plan section. So this list is significant because it represents the housing and community development needs that the city will focus on addressing during the 5-year consolidated plan period. These priority needs were established during a strategic planning session that brought together city staff across various departments to discuss all the findings of the previous section. And in this meeting, a total of 11 priority needs were identified, and you can see those here on this slide. And as you can see, the priority needs touch on all the different areas of the consolidated plan. So there's priority needs that relate back to affordable housing, community and economic development, supportive services, and all the other relevant topics that are funded by the consolidated plan. So once these priority needs were established, the next step in the process was really to develop a series of strategic plan goals that were aimed at addressing these 11 priority needs. During the strategic planning session, a total of 20 strategic plan goals were developed by city staff. And you can see in the next few slides, there are a handful of strategic plan goals that are associated with each areas and each of the topic areas of the consolidated plan. So here you can see that there were 5 strategic plan goals centered around affordable housing, goals that address housing for special needs populations, some goals that are focused on community and economic development, and then also goals that relate back to health, human, and social services. So over the next 5 years, these 20 strategic plan goals will guide the types of programs and activities that the city will fund in each of the consolidated plan's annual action plan budgets. And that's what I believe will be talked about next by the Department of Finance and Management, is going over the details of the first year action plan budget. So that pretty much sums up the process that we use to develop the consolidated plan and gives you a little bit more background information about each of the sections in the consolidated plan.
I'm going to yield the floor to Councilmember Tyson if she has any questions for you, Mr. Crafton, and I have several, so.
Okay.
Do you have any questions, Councilmember Tyson?
I do, just, I just want to know, can we have access to the market analysis that you said we didn't have time to go over today, and I understand that, but the market analysis in regards to housing, units, cost, condition, just that whole section, do you have more information in regard to this area?
Do you have specific information that you're interested in?
Well, okay, I'll just give you an example. I recognize the fact that we certainly don't have enough affordable housing. And so I'm just wondering if, when you said you did a market analysis, that you definitely have, more information to share with us. I'm just asking, do you have a report someplace that you could provide that information to us?
Yeah, and that's in all the information is summarized at the beginning of the housing market analysis section. So if you go to the front of that section in the Consolidated Plan report, we do have bullet points for each of the subsections in that summarize the major takeaways. For example, I think that there was somewhere right around 42,000 affordable housing units would have to be created just to meet current demands for the city's poorest households. 61% of households in the city of Columbus are low to moderate income. We have 4,700 households that are on the waiting list for public housing, and an additional 2,500 households that are waiting for Section 8 vouchers. So those kind of talk about some of the shortages and supply of affordable housing, and that's the sort of thing that is detailed throughout the housing market analysis. And I would say that the best place to find a quick summary of that is at the beginning of the section that has a 3-page summary that goes over those bullet points of the data findings.
Thank you. Well, that's important information, certainly understanding, by chairing Health and Human Services and also health, just realizing that we certainly don't have enough affordable housing for individuals in our community as it relates to the Community Shelter Board. So that is certainly a priority within this community. And so I will certainly read that part of the document. I don't have that full document here, but certainly would want to read that and begin thinking about working with, my council colleagues. Councilmember Mills certainly chairs development, but that certainly is a concern in this community. Thank you.
You're welcome.
Councilor Mills, the floor.
Thank you. I have quite a few questions, and I agree with Councilmember Tyson. I think the overview that you gave for the needs assessment and the market analysis was a little difficult to follow in terms of how it complements. And so if you could help share that, and again, given the amount of time and how much information, but to help some of our community groups and constituents understand how this all worked. For me, and I've been living this, as you know, for a few months in meetings and briefings about it, but even in your explanation this evening, it was a little bit challenging to follow how one fed to the other and how it all complements. So if you could take a couple more minutes just to kind of help and think about it as if I've never heard of CDBG funds ever in my life or don't know what a consolidated plan is.
Right.
But what is that information and how can our citizens understand that we listened? What we heard is this. Does that make sense? Kind of crosswalk to that, and then I'll give you my other questions that I have.
Okay. So the way that the sections of the Consolidated Plan work together were, our first step was really to ask the community, and that's what I described at the beginning of the overview, was getting feedback from the community on what they consider to be the greatest needs, housing needs in the community. So we did that through the resident survey and the focus groups. Now that's qualitative information because we're doing it through a survey method, and we're also getting that through interview methods. So in order to provide reliable data so we can actually see areas with targeted housing needs and targeted housing issues, we went to the needs assessment section, which collected secondary data from reliable sources so we could really begin to identify what the numbers are telling us. And the numbers were telling us, like I just talked about a second ago, that there is a big time shortage of affordable housing in the city, and that there's specific areas of the city that have more need than others. so that if we are going to fund more affordable housing, we should start to look at where where the affordable housing is needed most. The market analysis section also used data, but it was geared more towards making sure that the strategies that the city developed were strategies that would work within the housing market in the city of Columbus, with the recognition that without knowing the dynamic nature of the housing market locally, if we don't know that information, then we're not able to develop strategies that are tailored to the local market. So they're kind of opposite sides of the coin. One's getting the qualitative data from the citizens. The other side is looking at the numbers and seeing where there's gaps in those areas and how they relate to one another to create strategies that are addressing community needs and also addressing the needs that we're seeing in the data.
Thank you. My next question is just, can you, for clarity's sake, and I wanted to, I'm sure Director Rakowski is going to go over it, but when you make reference to the years of the plan, can you share with our listening and viewing audience what years the plan is covering?
Yeah, it's the 2015 to 2019 consolidated plan. So it's, 2015, and it's a 5-year period, and in 2020, a new 5-year consolidated plan will start at that point.
Right, I just try not to, you and I probably make that assumption, but it's
Yeah.
not fair to the listening audience if we do that. My next question is on the priority needs listing. Is this language, the language from the needs assessment, or is this language that we connected that from what we heard from the community, this is where it falls in terms of how we address it in the plan?
The language in the presentation was language that we heard from the resident survey. So these were the priority needs that residents identified.
And can you share a little bit, again, this may be a question for Director Rakowski, but addressing the flexibility in the prioritizing and the needs that the city has versus what is sort of prescribed, or is it directly from the residents to the plan? And is there any flexibility in there?
Yeah, that may be more of a question for the city. I know as we were developing the priority needs, our goal was to give equal weight to all sections from the consolidated plan. So recognizing that the community, the feedback from the community is just as important as what the data is saying. So we were trying to find those commonalities. What are the areas of needs that were being talked about by the community and that the data were also pointing to? And those were the priority needs that we tried to pull apart from the other ones and say, these are the top needs that we're going to focus on over the next 5 years of the consolidated plan from 2015 to 2019.
And my other question, just out of curiosity, in terms of community participation, would it have always been individuals 18 and over, or did we hear any voices from the young members of our community in terms of what they see?
From the resident survey, we did receive some responses from individuals that were under 18, and that's because we asked particular questions about their age groups. We had a question about that in the survey. So we did see a little bit of feedback from those individuals, but I would say the majority of the feedback that we received were from people aged 18 or over.
I think that was my last question. I believe it is, we hear again from Director Rakowski. Floor is yours. Next.
Thank you, Chair Mills. Again, the 2015 Action Plan budget outlines the proposed programs and activities of the first year of the consolidated plan. So for the citizens that may be listening or watching, we have this broader 5-year consolidated plan, and then annually we have the action plan, which we would normally call the annual budget, to implement these different programs and to expend the funds that are associated with these different grants. So what we just heard about from Mr. Crafton is that 5-year, larger, broader planning effort, really a justification and of the need for the funds, and also it's not just a justification, but it confirms those needs and it directs those dollars to the needs that are identified in the 5-year consolidated plan, and it does that on an annual basis based on the actual entitlement dollars that we get from HUD. And those can vary from year to year. And as you know, at this time of year, even though we're required to begin this budgeting process and go through this process, it is often later in 2015 before Congress passes the actual budget and we know exactly the amounts that we're going to receive, especially in the entitlement. And that's why we take a very conservative approach when we budget these dollars. We'd rather have good news and have some additional funds come in and then have another 30-day process and work with City Council as how we may reallocate those additional dollars, and we would go back in and reduce the budget, the annual budget, the action plan. So as you know, I know we've talked, and Council Member Tyson also understands we do take a fairly conservative approach, but it's one that's proven itself over time. Again, the budget promotes those priorities and objectives as identified in the consolidated plan, so it's a natural extension of the plan based on that annual amount and all of these grants. We did talk about those 4 HUD grants, as you can see on the screen. It lists the amount for each of those grants: the Community Development Block Grant, the Home Investment Partnerships Program, Emergency Solutions Grant, and the Housing Opportunities for Persons with AIDS. To address one of your earlier questions, the Community Development Block Grant, what we call the entitlement, really has more flexibility than the other grants. So when it comes to addressing needs with housing, it comes to addressing needs for the homeless and transitional housing, and it comes to addressing the needs for individuals in our community with special needs. The latter of those 3 grants are very targeted and directed to those needs, and we're restricted in the types of programs. Obviously, there are restrictions on all the money that we get from the feds, but those grants are very targeted to those portions of the consolidated plan that we went over earlier. Now, the Community Development Block Grant, we have a little bit more flexibility. It's where we deal with some of the economic development, targeted economic development needs, loan programs, and we do wrap in some of the other needs within those funds. But again, those latter 3 grants are very targeted, and that's how we address some of those very specific needs in regard to what we discover through the process. The CDBG grant is the largest of the grants. The proposed amount for 2015 is $9,128,365. Of that amount, 73%, or a little over 6.6 million, almost 6.7 million, represents the new HUD entitlement monies. The remainder of the revenue is program income and prior year carryover. The city is estimating a 1.19% increase over the 2014 funding levels. The 2015 budget represents an increase of $107,191 over this year's 2014 budget, and this is due primarily to an increase in the available carryover because, again, because we work often, I won't say we work blind on this, but we do take a conservative approach and assume that we will at least get a flat entitlement. And again, if that comes in above, we will be back talking with council as to how we might reallocate those dollars. And again, these monies are designed to assist low to moderate income residents and eliminate slum and blighted conditions within the city, again tying into that consolidated plan by implementing an annual budget that addresses those concerns and tries to meet those goals. There are some restrictions on CDBG funds. The regulations limit the amount of funding that we can use for public service type activities, and those activities include youth, health, and homeless services. No more than 15% of the CDBG funds can be spent on those public services, so this is what we call the public service cap. It also, the regulations limit the amount of funding that can be spent on administrative and planning activities. No more than 20% of CDBG funds can be spent on administrative and planning activities. Outside of that admin cap, we can use money for city staff if they're considered activity delivery costs. And some of those staff are considered and classified that way. And the proposed programs that make up both the public service and the administration and planning caps are identified in the 2015 Action Plan budget document. And if you look on page 66 of that document, it shows you the calculation in those programs that fund or fall under those two caps. You will also notice, again, because we tend to be a little conservative, we never go up to either the 15% for the public service activities or the full 20% when it comes to the administrative and planning activities, and that allows for flexibility within the budget throughout the year in case something would change, that we would not exceed those caps and make our friends at the federal government unhappy. If we look at the home partnership or the home investment partnerships fund, it's budgeted in 2015 at $3,651,552. Home entitlement funding, again, is projected to be level funded from this year's 214 funding. The home program income is projected at $225,000. All of these funds are administered through the Department of Development, and they are used primarily to increase homeownership opportunities and the preservation and production of affordable rental housing. So these funds are used to address that aspect of the consolidated plan. There are some additional restrictions that are both placed on us by HUD on this grant, but there are also some that are internal to the city. In regard to community housing development organizations, and many times you will hear those referred to as CHODOs. They will be funded using home monies. There's a 5% cap in regard to CHODO operating support, so that equates to approximately $171,000. That is a city cap, a city-instituted cap on operating support. There is also a CHODO project set aside of 15%. That's a floor. That equates to almost $514,000. This is a requirement of HUD, and these are required to be used as direct project dollars. There's also funded an administration, and this is city administration, a 10% cap that we self-impose. That's a little over $365,000. And then the balance of the funding goes to the Affordable Housing Opportunity Fund, a little over $2.6 million. These are all project dollars. If we look at the Emergency Solutions Grant, it's funded at $558,712, and it's used to coordinate and stabilize the base funding of emergency shelter programs. Again, this is level funding from 2014. The HOPWA grant is budgeted at $820,803. Again, level funding from 2014. This grant is administered through the Columbus Public Health. It is used to address the housing needs of low-income persons infected with HIV/AIDS and their families. And this program operates in an 8-county area. So again, the total 2014 budget for all of the 4 grants is $14,159,432. The proposed 2014 budget, it provides funding for 4 departments to implement programs and contracts that address those needs identified in the consolidated plan: housing, economic development, social services, and planning activities. The proposed budget lists the programs, the respective funding level, and there is a narrative description of each program, and that's starts on page 24 of the action plan. So for anyone that's interested, they can get very detailed information as to how the city is spending the money in these grants. And the narrative will explain how those relate back to the goals that were set forth in the consolidated plan. Some of the programs will be administered directly by community agencies. So the city anticipates entering into approximately 25 agency contracts with outside agencies to directly administer these funds. I want to talk a little bit, in addition to the public process, that we engaged in the construction of the plan, but there also is a public process associated with the action plan, which in this year, because we are doing the 5-year plan, includes that as well. CRP, Community Research Partners, described quite a bit of that, but they're also, as we stated earlier, we began a 30-day public notice process on October 11th, 2014. We do this to inform the public of the proposed consolidated plan, the action plan budget, and the citizen participation plan, and importantly, to receive their comments. We would like to receive any comments by November 9th, 2014. However, the earlier the comments we get, the easier it is to get those put together and get those back to City Council and the administration. And we hope to have this consolidated plan budget passed by City Council on November 17th. A little bit of additional information. We do have hard copies of the proposed 2015 through 2019 consolidated plan, the 2015 action plan budget, and the citizen participation plan. And any of these can be received, or all of them, by calling our office at 614-645-7492, or they also can be downloaded from the city's website. If you go to the finance department and you look under finance grants, the grants management section, there's available downloads of all of these documents as well. When it comes to comments or any other questions that might come up, all of those can be sent to the City of Columbus Department of Finance and Management at 90 West Broad Street, Columbus, Ohio, 43215. And if we'd ask those made to the attention of Philip Carter, because you'll get to them more quickly that way. If not, they'll come to me and I'll have to open them up and get them to Phil. Or we can have emails as well sent to PD Carter, and that's PDCARTER @columbus.gov. The legislation that we've submitted for the public's knowledge is ordinance number 2382-2014. And again, that totals $159,432. And again, authorized strength associated with CDBG and the home grant. And that's the maximum number of employees that we can hire under those grants is 55 full-time and 99 part-time. And then very quickly, because the Department of Finance, again, has a very small piece of that, of each of these expenditure categories, and it's all out of the entitlement, the CDBG grant. There's the grant management staff. That budget is $481,926. And our staff is responsible for numerous areas of grant administration for these 4 grant programs and other HUD grant programs. The activity applies for budget development, management of financial resources, regulatory compliance, HUD reporting, and monitoring. And then we also, in the finance department, we hold a loan servicing contract that's budgeted at $105,000. And we will continue a contract for loan collection servicing of the city's housing and economic development loan portfolio, and that is held by Amera National Community Services, Inc. And with that, that ends my comments, and I can take any questions.
Thank you, Director Rakowski. Councilmember Tyson, you have any questions for Director Rakowski? Okay.
Director Cascano, you gave an overview of the CDBG dollars for the City of Columbus, and my question goes to we just kind of received the document from the strategic plan, consolidated plan, and it shows some strategic goals that we want to focus on in the city. And so I know that when we went out and when Community Research Partners went out to the community and asked their feedback, and people have shared their feedback. I think that it's important that two things happen. One, even though we've gotten feedback and we've put our plan together, some of the strategic goals that individuals in the community said we needed are not necessarily a part of the plan. And so I think that I would ask the question that, and maybe you can answer this, that because people would begin to believe that once you highlight 4 or 5 issues out of each particular area, and then we don't have that in our plan, that we have to begin to either, one, it may not be in the plan, well, this is a plan through 2019. And so the question comes up, even though people have identified that these are issues in the community, however, they're not a part of the plan, how do we resolve that issue?
Chair Tyson and Chair Mills, I don't have a list of all of those goals or all of the requests that would have come from the public that would not be addressed here. I'd be happy to put that together and look at that. I will say that we also use our operating budget and our capital budget to address a lot of the needs that relate to these areas in the community. As you know, we have operating dollars in our operating budget that we use to help fund the shelter system, both for adults and families here in Columbus. We have dollars that we use for social service contracts that we use to address many of the needs that are identified in this in the consolidated plan, and some of those may be areas that we're addressing through the operating budget that we can't address through the plan because dollars are limited, as well as there are restrictions in what we can spend the money on. And again, not knowing what those how that matches up, I can't speak specifically to those. But we do use, as you know, our operating dollars in the operating budget to augment the dollars that are in the CDBG and the other grants that are associated with the monies we receive from HUD. We have also used capital dollars to help with renovation and building of shelters and housing, the demolition of housing and rebuilding of housing in targeted areas of the neighborhoods, the VAP program, other housing programs that we have through our capital budget have, demoed and acquired considerable amounts of vacant and abandoned housing and now are placing those properties in for redevelopment. We obviously do economic development programs through our operating budget and through the development department that are targeted to many of the same areas that would fall under the consolidated plan and under HUD-approved areas to spend. So if we're not addressing it here, I would say there's possibility that we're addressing it through our operating and capital budget. And having worked on budgets for my entire life, public budgeting, unfortunately, there's never enough resources to address all the needs that are out there, so prioritization always has to occur. It's unfortunate because we wish we could address all the needs, but we are restricted by the amount of funds that we have, so we do have to prioritize those dollars.
Thank you, Director Orkowski. That was the answer I think that the listening and viewing audience need to hear, because certainly these are federal dollars. We have priorities that the community has stated that are important to them, and that there are a number of ways some of those priorities can be met. And then, as the gentleman just when he spoke about the affordable housing, just listening to those sheer numbers, it would take a lot it would be very costly to get to that number. However, we know that we're trying to work on that. So I thank you for that answer, and it's important for the listening and viewing audience knows that because they gave the input doesn't necessarily mean that's not shown in this plan. There's other ways of trying to address those needs. Thank you. Thank you, Chairwoman Mills.
Thank you, Councilmember Tyson. The other question I had was sort of along the same lines, is when you talk about our budgeting conservatively and for some wonderful reason we would get more than what we're budgeting for, can you explain we don't necessarily start over because we've created prioritizing and we have goals and things we want to address, that if for whatever reason our award is more, the process of the reallocation, if you could educate the public on that, so that if hearing we receive more than what we anticipated receiving, that there is not an expectation of, oh, so now we can use those dollars to fund other things, that there still exists some restrictions. If you could cover that. Thank you.
Chair Mills and Chair Tyson, and I'll have Phil Carter jump in here if I get any of this wrong, because he's much more versed in all of this than I am, but I think it'll depend on the difference in the amount that we may receive, because if it's substantial enough, we will have to go through a period of public notice if it's substantial enough. What we would do, depending on what that amount is if it's significant enough, we would likely have discussions about where we might want to augment existing programs or find a new program that fits within the guidelines that we might not have been able to fund, and then go ahead and fund that program. What's happened in the past, when the amounts are not as significant as we might want them to be, we have added those to the reserve, because the reserve is what has allowed us to continue to flat fund and continuation funding of programs when the entitlement has gone down, which it has gone down. But because we do keep a reserve and we add to that, and we feel it's an adequate reserve, but being the finance director, I don't know that I ever feel the reserve is adequate enough, knowing what we've all gone through around here over the past 10 years or so. But we would then use that for the following year's budget to ensure that we could continue existing programs, and hopefully that we wouldn't have to cut any programs.
Thank you. I believe next we have Deputy Director Brandon to give us an overview and insight from the Department of Development. Deputy Director Brandon.
Thank you, Chairwoman Mills, Chairwoman Tyson. Good evening, and thank you again for the opportunity to present the Department of Development's 2015 Action Plan. The projected 2015 CDBG budget for the Development Department represents an increased funding level at, I didn't know I had to do both, I'm sorry. There we go. At $7,469,232. This 2015 budget is slightly higher than the 2014 budget and supports 40 full-time staff. The projected home budget for 2015 is $3,651,552, the same level as 2014, and these funds are used to increase home ownership opportunities and the preservation and production of affordable rental housing. The Emergency Solutions Grant is funded at a continuation level of $558,712, and this is used to coordinate and stabilize the base funding of emergency shelter programs. The 2015 CDBG budget allows the Development Department to focus its efforts on the core missions of the department and to address the priorities of the Consolidated Plan: economic development, housing, and neighborhoods. Some of the activities central to our mission are affordable housing, and that supports programs like accessibility modification, emergency repair program, vacant property prevention, homeownership assistance, chores and deaf services, and miscellaneous contract services. $3,115,070 will be used to provide new housing units for homeownership and rental, $72,604 to support housing counseling for new home buyers and homeowners threatened with foreclosure. $105,456 will support fair housing and investigate concerns. Through these programs, 765 households will receive rehabilitation assistance in order to create decent, affordable housing. There's also an opportunity to assist housing for people with special needs, our homeless support, repairs for elderly and disabled, and home modification for those with mobility and hearing impairments. In our neighborhoods, funding the Neighborhood Design Center Code enforcement, which there's staff of 8 that are currently funded with CDBG funds. Support for the land redevelopment program, and our economic development also supports our neighborhoods with the Economic Development Fund. It's $72,000, and it supports business associations throughout the city. The Long Street Business Association, Mount Vernon Business Association, Franklinton, Hilltop, Parsons, and Main Street. I think I need to move. Some of the proposed goals that we have in our Land Redevelopment Office, we will continue the effort in 2015 to secure, board to code, and mow all land bank properties, as well as acquire and demolish blighted properties. This is to ensure compliance and set an example of responsible home ownership. In economic development, over 165 businesses will be provided assistance to create or retain 1,300 jobs, resulting in over $50 million in new business development investment in Columbus. Through our neighborhood services, we will continue to support 5 neighborhood pride centers and serve 17 area commissions and 185 civic associations. Continue to respond to service requests by residents, neighborhood groups, and business associations, and again, retain the code enforcement levels in the CDBG-funded communities. In housing, the Affordable Housing Opportunity Fund, again, 700 households will receive repair and rehabilitation assistance in order to create decent, affordable housing. 50 households will receive down payment assistance to provide decent, affordable housing to first-time home buyers. I'll move on now to some of the accomplishments as of September 30th in 2014. In housing, we have served 35 first-time home buyers with down payment assistance. We've seen the completion of 110 affordable rental units. We've monitored 48 rental projects and provided $171,327 in operating support to 4 community housing development organizations. We have also finalized 57 tax-abated properties. Some additional accomplishments that you'll see, we've completed 218 chores projects, and those are minor home repairs for our elderly and disabled citizens. We've provided equipment to assist 22 households with a hearing impairment. We've made 22 homes handicapped accessible, served 355 homeowners with emergency repairs to their homes, served 647 persons in the Rebuilding Lives program, provided shelter to over 5,800 persons, supplied rental assistance to 134 persons, and served 80 households with emergency vacate orders. Our 2014 neighborhood and economic development goals, some things we've accomplished thus far in 2014. We've assisted 22 businesses with the creation and retention of 1,840 jobs. We've conducted 4 neighborhood safety academies with 200 graduates, provided 160 bicycle helmets at neighborhood pride bicycle safety festivals with 1,700 students participating, maintained 120 city-owned properties, mowed and maintained 443 properties, and over 20,000 requests for service or information was handled by our neighborhood liaisons. In summary, we will continue to work to make Columbus a great place to live, work, and raise a family, ongoing commitment to economic development, neighborhoods, and housing, and thanks to community research partners for their efforts in working through a new consolidated plan layout. If at this time you have any questions, I welcome them and hopefully you'll answer.
Deputy Director Brandon, I do have a couple questions. I want to help those who want to have some knowledge about the plan and the prioritization that we have outlined here. When I look at the list of the priority needs as it lists here, it sounds like from a development standpoint that 7 of the 11 are addressed through the dollars that are a part of development. Does that make sense? Does that sound about right to you? The one that I'm trying to crosswalk to what you described in terms of what we plan to do that I don't see, if you could help me find it, or maybe I've not looked carefully, equal access to housing. Can you tell me how we address the priority need of equal access to housing? I see some of the others, and the other one I'm looking for is self-sufficiency of low-income residents in the priorities. And again, maybe I've missed it, but if you could help me crosswalk to how that is addressed in the plan. And again, to the earlier comment that we may not be able to address all the needs identified by the residents, but I'm just curious to see where those might be in the plan.
Okay, thank you, Chairman Mills. Under the priority need, equal access to housing, I know that our department funds $105,000 that supports fair housing, and those fair housing investigations could lead to that. So that area would cover the equal access.
And if you could touch on the self-sufficiency of low-income residents for me, please.
If you don't mind, I'd like to see if our housing administrator could assist with that, because if it is something that's covered, I want to make sure that the viewing audience knows that. I don't have that information, but I would like to call Rita Parise up if she's able to identify or locate that in the priorities that we have for our department.
Sure, absolutely. Welcome to council hearing.
Good evening, Chair Mills and Chair Tyson. Relative to the specific goal of self-sufficiency, there is really nothing within the consolidated plan and the way that the funds are being driven to work specifically on the area of self-sufficiency. There are some areas around that support moving towards the goal of self-sufficiency. So for example, moving into safe, affordable rental housing. Clearly, if you are in a more affordable unit and you're in a safe unit, you are going to be able to maintain your housing and become more self-sufficient. Moving and working with first-time home buyers, so in down payment assistance as well as the homeownership development program. We are working with individuals of moderate means, giving them the opportunity to become homeowners, which obviously, in addition to providing stability, is an asset-building opportunity for them. In those regards, we are addressing the self-sufficiency aspect. Relative to programs, social service programs that work on self-sufficiency, a lot of that currently, I believe, is being dealt with in the human services funding through Chair Tyson's committee and through her efforts. That is primarily outside of the federal funds budget, but it is, as Director Okoski mentioned, just because it's not in our federal funds budget doesn't mean the city isn't doing it. It is being addressed, it's just being addressed with a different funding source.
Thank you. That's what I'm hoping to educate the public on, that because they don't see it if it's here. Sometimes just crosswalking to what we listed as a priority and what the actual action step looks like isn't always the same thing, just as Deputy Director Brandon talked about with equal access to housing, because the crosswalk of the language is not the same, doesn't mean we're not doing it. And also Director Rakowski, as he put it, does that mean the city is not addressing this? It's just as it relates to the funds in the consolidated plan. Thank you.
Exactly. Thank you.
Thank you, Deputy Director Brandon. I believe it is now time to hear from Audrey Regan, Director of Sexual Health Promotion for Columbus Public Health.
Great. Thank you very much.
Ms. Regan, the floor is yours.
Thank you. Thank you, Councilmember Mills, as well as Councilmember Tyson, for this opportunity to update you on the Community Development Block Grant programs administered by Columbus Public Health. As you mentioned, I am Dr. Audrey Regan, and I would lead Columbus Public Health Sexual Health Promotion Unit. There are several activities performed with the CDBG resources that I'm going to speak about this evening. The first is community-based HIV and STI screening. The second is pregnancy screening and parental support. And the third is housing for people living with HIV and AIDS. Currently, Franklin County is experiencing a syphilis outbreak, and as the graph illustrates, the rate of syphilis has been increasing since 2001. However, we've seen about a 40% increase in the number of syphilis cases when we compare the first 6 months of 2013 with the first 6 months of 2014. First 6 months of 2014, and we've also seen 6 cases of congenital syphilis. The reason that I bring this up is a key strategy for us in addressing syphilis in our community is to offer community-based screenings, which is what the CDBG grant enables us to do. Community-based screenings is critical service for us to offer to our residents, and it enables us to address barriers that residents encounter when they're trying to access healthcare services. I can slide this way. So we have a team of public health associates that partner with community-based programs to provide STI screening for syphilis, as well as chlamydia, gonorrhea, and HIV. There are 7 staff members in total, and CDBG funds 1.5 of them. These staff focus specifically on serving African American and youth communities because these 2 communities have experienced health inequities previously. So we have provided some examples of places where we do STI screening, such as park and recreation facilities, homeless and transitional housing sites, alternative education sites, community-based support service agencies, and evening clinics at Columbus Public Health. The entire community services screening program has performed about 1,100 tests in the first 6 months of 2014 and diagnosed about 60 cases of chlamydia, 116 cases of gonorrhea, 5 cases of syphilis, and 2 cases of HIV. Specifically looking at our CDBG-funded staff, they've screened about 250 individuals, and I put these demographics up to show that they are reaching their target of testing African American and youth less than 30 years of age. As I mentioned, we are successful in finding STIs, diagnosing 22 cases of chlamydia, 10 of gonorrhea, and 1 for syphilis. As I mentioned, we also provide pregnancy support services and have served 52 pregnant and parenting women and administered 45 pregnancy tests. These women were recruited from walk-ins as well as non-traditional educational institutions, health fairs, referrals, and CPH, Columbus Public Health's Farmers Market. In addition to the pregnancy tests, these women received education on pregnancy and infant health and development. They were linked to prenatal care and other social services. They were assisted in applying for Medicaid and WIC, the Women, Infant, Children program, which is a healthy eating program, and helped with enrolling in secondary educational opportunities. An additional prevention effort that Columbus Public Health is seeking to launch is an effort towards a comprehensive effort towards youth wellness, and we will be building off the CDBG efforts to implement the Teen Outreach Program, which is an evidence-based initiative that's been going on across the United States as well as in a couple of places here in Ohio, and it shows success in improving educational attainment as well as reducing teen pregnancies. We're very excited about that. The third program of Columbus Public Health is the HOPWA program, and the HOPWA program is very important because achieving viral suppression or properly managing your HIV helps with preventing the spread of HIV in our community. Achieving viral suppression reduces the chance of spread and allows people to live healthier lives. And if you aren't in stable housing, it minimizes your ability to effectively manage your disease. So CDBG funds, along with HOPWA funds and the Ryan White Part A HIV housing program, has allowed us to support housing for 100 households with long-term rental assistance and an additional 47 households with short-term rent and utility assistance. So in conclusion, the work that Columbus Public Health is able to do because of the Community Development Block Grant and HOPWA is very important to us, and I sincerely appreciate and thank you for allowing us to continue these efforts. And I'm available to answer questions.
Ms. Regan, if you would help me with connecting the programs and support that you just went over to the priority needs.
So the 4 priorities that were identified under Health, Human Services, and Social Services, the provide education and recreational youth programs, I'm going to defer to my colleague at the Department of Parks and Rec to speak a little bit to that. But we certainly do conduct a lot of education in the community about health. Certainly, decreasing the incidence of STIs is why we do the screening in the community and assure treatment for those individuals who need it. Infant mortality is related to our work with the pregnancy education and pregnancy testing. And similar to what my colleagues have mentioned in the Department of Finance, improving access to healthy foods is something that Columbus Public Health is very committed to. And while we may not do it with community development block grant resources, we certainly do have other programs such as the WIC program, the Women, Infant, Children program, Healthy Corner Stores initiatives, and other things of that nature.
Ms. Regan, I might need to go back to our representative from CRP and answering the question because those were their slides that they prepared. My question is on the priority needs that are listed versus what's in the strategic plan. And I think what you referred to was in a strategic plan. My question is on the priority needs and the connecting of what we fund for the screening activities and all that connecting to the priority needs.
So the relationship between the priority needs.
I'm sorry for those who may have just tuned in. If you could please state your first name and the organization, and then the floor is yours now.
Sorry. Zachary Crafton with Community Research Partners. The relationship between the priority needs that are listed in the consolidated plan and the strategic plan goals, the priority needs represent what was distilled from all the information that we collected and analyzed throughout the consolidated planning process. So the priority needs really relate to our findings. These are our largest findings. Whereas the strategic plan goals are related to the operating budget and more of what the Department of Finance and Management was talking about, is that we can have priority needs that we've identified through the consolidated planning process and collecting that information, but there may not be, we still want to list those in the consolidated plan, but there may not be opportunities with the the consolidated plan's budget to fund those priority needs. So there are some cases where there's a little bit of disconnect, but we want to make the community aware that their voices were heard, and as you're hearing from some of the other departments, these priority needs are being funded through different avenues. So that's why we have them both in the consolidated plan, but that's also why there's not a complete connection of the dots between all of those.
Thank you.
You're welcome. Thank you.
Ms. Regan, did you want to add anything else to that? 'Cause I think you all understand what I'm hoping to educate the public about, is that the priority needs are here, but then there's other funding that's happening that are not necessarily connected directly back, and how we talk about the needs from a community broad perspective of how we use the dollars that meets many of the needs that are considered a priority and some of the other needs that we know exist in the community, which I believe is what you were describing, correct?
Yes.
Could you add a little bit more context to that?
Sure. I think many of the programs that we do in the health department and the connection here with a lot of these really goes to the social determinants of health and the importance that all of these elements have in allowing people to improve their health and maximize their life satisfaction.
Thank you, Chairwoman Mills. I mean, there's just a number of reports. There's an action plan that has similar information. So we have an action plan and a consolidated plan and an action plan. So we have two plans, and there's many similarities. But then I think based upon some of the comments that the residents have provided us, some of those happen to be more so in the action plan. So we have a couple plans that we're really looking at that give us, which is really great, it gives us a lot of really good information as we as we move forward in understanding what the different needs of our community happen to be. And obviously, some are going to be addressed through the federal dollars, and many of those are going to be addressed through state and local dollars. So I think we have a number of reports that we're looking at, and I think that's where we're having some of this discussion. And many of them many of them are the same, but then there are some differences based upon, I think, some of the needs that we have begun to discuss in 2014.
Chair Mills and Chair Tyson, I would say that the consolidated plan addresses community-wide needs in many different areas, obviously not all of which can be addressed through the grants that we're talking about tonight. But we take a multi-pronged approach. We understand the needs of the community, and we use all the tools that are at our disposal to do that. We use the operating budget, as I said, and direct service delivery and direct service provision through City of Columbus personnel. We have a lot of outside contracts with outside entities, and we support a lot of social service and nonprofit entities out in the community that address many of these same issues through our operating budgets. And then again, we do use our capital budget as well to provide infrastructure dollars to help create better housing in Columbus, remove blight. Our police and officers are used even in, our gang unit, and our targeted enforcement during the summer addresses many of the same neighborhoods where there's other types of blight. In the health department, they have a provision of immunizations. They do all kinds of prenatal and perinatal care that they provide, all of which address many of these areas. We have code enforcement, that we fund a significant amount of operating dollars that I believe address it crosses over many of these priority needs, because going into neighborhoods, addressing high weeds, cutting, vacant lots, boarding up houses to avoid drugs and prostitution and other things that occur in those properties, tearing down those structures, making sure that landlords are being responsible in these areas of our city that we're trying to revitalize, all tie in. So it's one piece of a large mosaic of dollars and efforts that the city puts forward to address those issues that have been identified in the plan.
Thank you, Director Rakowski. I think, I hope anyway, we've done a great job in sharing with the public that this is one plan and one set of dollars that we do address priorities with our entire operating budget. But I just want to make sure that because we've made the statement of, we've taken the feedback, we've listed the priorities, this is how we're addressing how it's in the plan, that it becomes our responsibility to explain how certain things make it in the plan, and whether we're funding it through capital or other ways of addressing those needs, that how some of those things fit in the plan, and why we make the decision on the community need that they meet in the plan, and not just from the citizen participation part directly into the plan, that we take all those things in consideration based on our other efforts that we're doing with city funds, whether it's capital or operating. I believe our last and final presentation is from Director Allmiller, if I'm correct, who will be sharing with us the plans and goals as it relates to recreation and parks.
Good evening, and thank you, Chairwoman Mills and Chairwoman Tyson, for allowing us the opportunity to present our small but we think very important part of the CDBG budget. I think it's nice to see that people think that after-school programs and education is important for the community. I think we all can realize that it makes the neighborhood a better place to live if you've got a nice, safe community center that's well-staffed and has a lot of positive programs going on. So happy to see that. We have 4 programs, 3 of which we run ourselves. First of all, our budget proposed as submitted is $843,932, and that's divided into 4 separate programs. The first being Capital Kids After School programs, that the funds pay for the 4 full-time site directors who work closely with the schools and the neighborhood and the kids to provide after-school tutoring. We partner with Capital University. They've got arts and crafts, games, special events, but it's focused mostly on tutoring and working on what they need to accomplish at school. There's a lot of reading going on, so that's our important piece of our educational program. We serve 30 children K through 5 at each of the 4 sites. They also, after the school year, they offer an 8, actually this summer will be 9-week program in the summer, which is pretty much the same with a few more field trips and fun activities, but there's still some scheduled tutoring and reading sessions. Our second program is the Schools Out program. It's a summer camp that we run at 4 sites in the CDBG areas. Those 4 sites are, this summer, were Barrick, Thompson, Howard, and Blackburn Recreation Centers. Thank you. We can accommodate up to 65 individuals, so about 300 kids per summer run through that. Cynthia Lee and Timberly Leffler have been running that for years, and they do a great job. It's always one of those that fills up in a hurry, and we have a waiting list. Our third program would be funding of the part-time recreation center staff at 10 of our centers. In, I believe it was 2009 when we had to close some centers, and when we reopened, we came up with some funding through the CDBG funds to help fund our part-time staff that comes in and teaches, have tutoring. They've got fine arts, performing arts, all the sports, the fitness. So without them, we wouldn't have the variety of classes we're able to offer, and we really appreciate that. The fourth program is a pass-through. It's the Columbus Kids Ready, Set, Learn. It's $50,000, runs through the United Way of Columbus, and that's a program that also received $250,000 of the general fund dollars in 2014. It's basically a program that tests and prepares kids to enter kindergarten. And if anyone has any questions, I'd be willing to answer them or try.
I was just making sure I was educated on the Columbus Kids dollars. I was checking with Councilmember Tyson about the dollars being amendment dollars versus general fund dollars. I believe that concludes our presentation, and I will yield the floor to Councilmember Tyson for any closing remarks.
I'd just say, I'm going to say thank you to each of the directors that are here today that have certainly gave us an outline of the consolidated plan and the action plan for 2015, but the consolidated plan for 2015 through 2019. And again, the consolidated plan provides a strategy to improve the economic conditions and fortunes of residents in our community. This plan focuses on enhancing affordable housing, services for special needs populations, housing options for our elderly, equal access to housing, and self-sufficiency for low-income residents, as well as focusing on housing opportunities of individuals with AIDS, sexual awareness programs, and recreation and parks. So these are just some of the few areas that were again highlighted today, but they are so important to our community continuing moving forward and allowing everyone to have a great quality of life. So I thank you for your presentation this evening as we continue to move forward to making sure all of our residents, again, have the greatest opportunities to be able to move forward. So thank you. Thank you, Chairwoman Mills.
Thank you. Now we have concluded our presentation portion of tonight's hearing. Is now to our last order of business today, which is our public testimony time. I have one speaker slip, and I'll ask if Mr. Nathaniel Wilkins will approach the podium. Mr. Wilkins, thank you again for coming and being an advocate for your community. You have 3 minutes to share your comments related to tonight's hearing. Welcome again to council.
1612 Arlington Avenue, Mr. Latanya George Wilkins, the chairman of Solid Vacant and Abandonment Property in North Linden area. I'm just all new to this, so I just kind of thank the director over me, Nikki Brandon. Again, I've just got several questions. I know that we always talk about fair housing and fair housing opportunity, and also talk about vacant and abandonment properties. First of all, I'd just like to get a clarification. What's going to happen that we all have all these houses that sit empty year after year, and what's going to be done with them? Also, the other question is for sexual health. There need to be more educated young people to be aware of that, especially older population. Also, the other question is, we talk about special needs with people with disabilities, also with visually impaired, and also the elderly population. I know that was left out in quite a few of your comments. So if you can explain to me, what will y'all do for elderly people that live in some of these communities and some of these houses? The other issues are recreation and parks. I do want to say thank you for what you all done for the kids, but there ought to be more opportunity for the young people, especially with young families. So again, thank you for your time.
Thank you, Mr. Wilkins. I'm going to try to capture all of what you've asked us to share with you. I'm first going to ask Deputy Director Brandon to speak to the housing as it relates to special populations, both elderly and those who have limited capabilities. Deputy Director Brandon, I'll ask that you respond to that part, and then I will talk with Mr. Wilkins in response to his question about how we plan to address vacant and abandoned housing.
Thank you, Chairman Mills. With regard to our ability to assist those with special needs, we do have $500,000 allocated to accessibility modifications. We also have $320,000 for our chores and debt services program, our homeless support and repairs for elderly and disabled. There's also allocation for home modification for those with mobility issues and hearing impairments. So there are other programs, as we've talked about already, that are funded with different sources, but with regard to CDBG and what's here in our action plan, those are some of the programs that we have to assist our residents who have special needs.
Thank you. And Mr. Wilkins, just to kind of go over again that not only our efforts to address the lawns and the care of some of the vacant and abandoned housing, there's also our VAP program that operates that addresses blight and vacant and abandoned housing. And I know that this is a very big passion area for you. I want to continue to engage you in those conversations as we continue to try to address the problem not only in your community, but in all of the neighborhoods throughout our city. That concludes our public testimony. Having no other speaker slips, I just want to provide some closing remarks and some thank yous to all of those who participated in tonight's hearing, the presentations, thanking them for their time with the community, their time with my office, and the toleration of all of my questions. Thanking you all for that. As we have learned in greater detail that the funding we receive from the United States Department of Housing and Urban Development is vital for most of our important programs, but certainly not all of them. The funds are limited, there are some restrictions to them, and there is but so much to go around, and we do our best as a city on whole to address the priorities and issues that are important to our citizens. These dollars fund home repairs for senior citizens, provide after-school program for our children, health screening, and some of the other services to serve our most vulnerable residents. If individuals have not had a chance to participate in the citizen engagement portion of this, as well as not able to attend tonight's hearing, there is still time to provide us with feedback. We would like that feedback timely, as we want to give it the consideration that it needs, but we will also need the feedback timely. We've tabled the ordinance that we certainly hope will pass a consolidated plan, and we want to make sure that, again, we allow citizens a chance to tell us what they think about the plan. I want to remind everyone that those comments, again, need to be timely. so that we can give them the consideration that they need. We want feedback, but we certainly want it timely so that we can give it the consideration that it needs. And so with that, I ask that the listening audience and the public provide us comments about the plan and direct those comments to Philip Carter with the Department of Finance. And Mr. Carter can be reached via email at pdcarter@columbus.gov. You can request hard copies about the plan if you want to learn more by calling the Department of Finance, and their telephone number is 614-645-7492, or certainly you can visit the department's website and look for the document under grants management. Thank you again for those of you who've taken the time to engage in the process. I want to thank all of the organizations and the groups that worked with CRP to give feedback and provide their input on what we see as priorities for going forward with not only our 5-year consolidated plan, but also our action plan. Thank you all, and look forward to timely comments and feedback on the plan so we can give it the consideration that it needs. Thank you again, and if there are additional questions or comments, please feel free to contact my office. Have a wonderful and safe evening.